Good morning, everyone. I'm Sarah Lorenzini, and I am a rapid response nurse. So I want to start the day off by just explaining to you what is rapid response nursing. So our role in the hospital, I like to explain as we're basically like the paramedics inside the hospital. With regards to when there's an emergency outside of the hospital, you call an ambulance and the paramedics show up with their skills and expertise to take care of the person who's having an emergency. So in the hospital, you wouldn't call an ambulance, you would call, at least in our hospital, the rapid response team. So every hospital has a different process that they use. Some places they will deploy people from different areas when there's a rapid response need. So like the ICU charge nurse and a respiratory therapist and a specific doctor will come. In our hospital, we have designated nurses that's all that we do all day long is respond to emergencies. But what I like to share is that we don't just sit around waiting for emergencies to happen. We are proactive in finding patients who might be declining and preventing the emergency from ever occurring. So what does a typical day look like for a rapid response nurse? The answer is there is no typical day, just like any role in nursing. So we have a couple ways that we will do proactive interventions. We will pull, at our hospital, it's called the MUSE, or Modified Early Warning Score, MUSE. Every time vital signs are taken, we can see those, and patients who have a high MUSE, a high score, we'll go proactively see them and see if they can get interventions before the patient gets any worse. So like the blood pressure is a little low and the heart rate's a little high, we'll go investigate and figure out what's going on. And then we also respond to any rapid response calls or code blue events, or MTP, massive transfusion protocol, or stroke alert, or STEMI alert, or sepsis alert. Any emergency happening within the hospital, we show up with an extra set of hands, extra set of skills to help the patient and also help the nurse who's the primary for that patient. So I want to take a minute to talk about my journey to becoming a rapid response nurse and educator. So I started my career almost 20 years ago in the ER as a brand new grad out of nursing school. I never thought I'd be an ER nurse. I actually wanted to be a midwife when I started nursing school, but I got a job as a nurse tech while I was in nursing school. Best decision ever. So I got to see all the different roles in healthcare, and I came to learn that I love emergencies and I love being there for patients and also families who are in crisis. I really enjoy the opportunity to bring some hope or some healing or some clarity or dignity on a really hard time when patients and families are suffering. I like to be there with them in that. So ER nursing was a good fit for me. I think people assume that, oh, you must be an adrenaline junkie if you're an ER nurse. And I think most of us are, but that's not the primary thing that makes me love ER nursing. I really just love the opportunity to be with people on a really bad day. So then after being an ER nurse for about 9 years, I went and worked in the cardiac ICU. Huge learning curve coming from only ER to having to learn all of the gadgets and devices and monitors that are inside of patients in the ICU. But I really enjoyed that environment as well for some of the same reasons. I like being there for people on a hard time, and having open heart surgery is kind of a big deal for both the patient and for their family. So I really enjoyed that environment. The pace was very different than the ER, but I kind of appreciated the opportunity to spend extra time with each patient. So after doing cardiac ICU for a while, at that point I was in grad school for nursing education. And then I was asked to be on the rapid response team at that hospital. So I did rapid response nursing for a while. So rapid response nursing was awesome because it was just the perfect mix of ER nursing, jumping in and figuring out what's wrong with the patient and quickly stabilizing them. And then also critical care nursing because I got to do all of like the analyzing and the looking at the lab values and critical thinking and hemodynamics and figuring out what should be our next best steps. So I loved rapid response nursing. But at that point I had only completed my master's degree in nursing education and decided I wanted to be a nursing professor. So I was a nursing professor for a whopping 1 year, and I loved it so much because I love nursing students and I love the schedule because I'm a mom of 5, but I still missed the bedside. And so my friend, who was actually my charge nurse when I was a new grad in the ER, he had become the ER director, and he called me up and asked me to come back and be the ER nurse educator at the hospital that I started at as a baby nurse. So I was the ER educator for 5 years, and then COVID hit, and that's when I was like, man, as much as I love teaching nursing and I love supporting nurses in this role, I still want to be at the bedside, especially with this pandemic. I wanted to be in the trenches with my team, taking care of these patients. And so that's when I went to my hospital leadership and said, I'd like to start a rapid response team, a dedicated rapid response team at our hospital, because we need to support the patients and the staff in this crazy time. You know, staffing is challenging, acuity is at its highest, and we need that extra like surveillance and support for the bedside nurses when patients are getting sicker, because they're all getting sicker with COVID. And so that's when I started the rapid response team at my hospital. Response team at my hospital now for about 3 years. And that brings me to where we are now at 20 years of my career. So I really enjoy rapid response nursing. And I've enjoyed the opportunity to start a team at my hospital. So if you have any questions about how to start a rapid response team in your hospital, I would be happy to answer those as well. I'm really passionate about not just the clinical aspect of being a rapid response nurse and having the aptitude and competence to know what to do in emergencies, but also, to me, the emotional intelligence to know how to read the room and come alongside nurses and support them, and not just think that you're like the hero coming in to rescue, but also that you are an educator and a mentor, and that you are nurturing the staff. The whole idea of like, don't just give someone a fish, but teach them how to fish. I see that in nursing as well. I could just come in and do the rescue of the patient, or I could teach the nurse how to do it themselves and watch them do it excellently next time. All right, Q&A time. What kind of experience you need to be a rapid response nurse? So this depends on the hospital, honestly. At my hospital, you need to have 3 years of critical care or ER experience, and you have to be certified in your specialty, so CCRN or CEN. But not every hospital requires that. I think it just kind of depends on your facility. To me, just as important as your clinical experience is also your experience being a preceptor, being a mentor, being an educator, being a resource on your unit. All of those are just as valuable as, say, the certification of the CCRN or CEN. So similar question. I would say to become a rapid response nurse, the best thing you can do is become an expert in your area, wherever that is right now. So if you are on med-surg, become an expert there. If you're in the ER, become an expert there. If you're in the ICU, become an expert there. Take your certification to kind of validate that you really know that knowledge. And then make yourself a resource on your unit. So become a super user in whatever equipment you have in your unit, or your whatever processes or patient populations. You want people to look to you as a resource, as someone they can go to when they have questions, when they have concerns. Because when you're the rapid response nurse, you are that for the entire hospital. So if you don't have that reputation on your one unit, how could you build that for the whole facility? So that's the first step in becoming a rapid response nurse, is become an expert in something. And step 2, I would say, would be to make sure you have that critical care experience. So in the ER or ICU, I have both, but I don't think both are always required. And then step 3 would be get your certification. So CCRN or CEN. Again, not every facility requires that for the rapid response nurses, but it definitely gives you a leg up, both for your resume, but also just your own knowledge and confidence in your knowledge, because the more confidence you have that you know your stuff, the more you can confidently advocate for your patients whenever they're crashing. So the certification is a good stepping point for that. So again, for critical care, it's the CCRN or Critical Care Registered Nurse. And for emergency nursing, there's the CEN or Certified Emergency Nurse, both of which are very hard tests to pass. You have to have some time under your belt in that specialty, in ICU or in ER. You take the test, you pass it, now you're certified, and you can add that to your resume and to your confidence that you know your stuff as a rapid response nurse. Next question, what do I love about being a rapid response nurse? Basically everything. So I love the critical care aspect of it. When patients are crashing, having to think on your feet and quickly make decisions about what needs to happen next. Are we treating preload or afterload or contractility? What medication do we need? And like go, 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 go. Like the quick assessment and determining what's wrong with the patient, like the detective work I enjoy a lot. But I also just enjoy like being there for the patient and the family whenever they're freaking out. Like I have the ability to simultaneously think quickly, work quickly, but not forget that the patient's right there, and be able to explain to them what I'm doing and why I'm doing it, help to calm the family, or at least explain to them what's going on. I really enjoy that. The other thing I love about being a rapid response nurse is the education aspect of it. I love educating about nursing. I have my master's degree in nursing education. For me, it's such a joy to talk about this profession that I love so much. And so as a rapid response nurse, I get the opportunity to come alongside the nurse, to explain what I'm doing, what I'm thinking, to help them respond quickly for this patient. We'll critical think together. So it's not all just like slinging epinephrine and doing CPR. A lot of what I do is coming to what we call nurse consults, where the nurse says, I have a question on my patient. Is this an emergency? Should I be concerned about this, the way they're breathing? And I get to explain to them why I am concerned about that, yes, or why it's probably okay, or what to watch for, worst case scenario. So the teaching aspect I really love about rapid response nursing. And then the final thing that I love is that every day is different. You know, I don't have like a home unit. I don't even have like a place to put my stuff down, like a nurse's station. Basically, I am responsible for the whole hospital. And so everything that I need, I have to carry on me. So I carry a backpack. I have a fanny pack that I wear, which I get made fun of for. But I just have to be ready wherever I am. So I don't ever know who I'm going to be working with, or their level of skill or experience, or where I'm going to have emergencies, or what type of patients it's going to be. Even as I'm running to the emergency, I don't even know if it's going to be a respiratory emergency or a cardiac emergency or an old person or a young person or a psych emergency. Like, you just figure it out when you get there. And so if you are someone who loves that, you love rapid response nursing, but if you like everything to be more predictable, maybe don't do rapid response. But I find that very challenging, and I love a challenge. So over the past week, I've actually interviewed my coworkers and asked them what they love about rapid response nursing. So I will share those videos with you now just to get someone else's perspective besides just mine. Walker, why do you love being a rapid response nurse?
There's a lot of different reasons why I love being a rapid response nurse. Number one is I love being able to bridge the gap between, ICU, ER, CDU, PCU, med-surg units. I like to be able to make sure everybody works as a great team together. And then, of course, I love being able to help all the patients and making sure that they get the help that they need at the utmost best care that they can possibly have.
Awesome. Nathan, why do you like being a rapid response nurse?
I enjoy using my skills and experience to help our patients.
Love it. So Elizabeth, tell me what you like about being a rapid response nurse.
What I like most about being a rapid response nurse is being there for the patients and the nurses, because they're both scared.
That's awesome. You're good at it.
Thank you.
All right. So Jacob, what do you love about being a rapid response nurse?
Oh, my favorite part about being a rapid response nurse is being a good resource for the hospital and being a subject matter expert when things get tough and giving the patient a chance.
I love it. Marissa, why do you like being a rapid response nurse?
I love a new challenge every day.
Perfect. This is a great question because I definitely did not set out to be a rapid response nurse when I started nursing school. I would say it kind of found me because it is the perfect mix of all of my favorite things, being ER nursing, ICU nursing, and nursing education. I actually was interviewed by Nurse Alice on the Ask Nurse Alice podcast. So I'll put the link here for you if you wanted to check out that podcast episode and the blog post that came from it. Great question. I think a healthy bit of fear is actually a good thing because you should have some concern when a patient is dying, right? You shouldn't just be like, no big deal. I think I have learned to interpret those sensations of like my sympathetic nervous system dumping epinephrine and norepinephrine and my heart's racing and my hands are shaking. I've learned that that actually is a signal that my body is getting ready to perform at its best, like it's go time now. And so even though, yes, I feel terrified, I know that I can do it because I have the experience, I have the training, I have validated my expertise through certifications. I do know this stuff, and so I just have to recognize that my body's giving me what I need to fight for this patient's life. But to further answer this question, it's not like I graduated nursing school and bam, I was ready to be a rapid response nurse. It took me years of training and practice and failing and embarrassing myself and not making the right decision and, feeling like I couldn't do it. But eventually with time, I grew the skill set, not just to like clinically advocate for the patient, but also like within the interdisciplinary team, know how to function and lead the resuscitation. It took years to develop that. And so the confident rapid response nurse you see today was not the baby new grad that I started out 20 years ago. So don't feel like if you just If you don't have this skill set right out of nursing school, that you're not meant to be a rapid response nurse, not at all. Just know that there's some training and experience and practice that you have to get under your belt. And then if you want to do it, it's a very rewarding niche in nursing for sure. All right, your turn. Have you ever had to call a rapid response on one of your patients? And do you have any questions at all about what to do at a rapid response? This is a great question. So when I went in front of leadership to ask to make a dedicated rapid response nurse, so not to have nurses being pulled from ICU to go to emergencies, but I have a team that just does that all day long, I had to lay out all that we had to offer. So not just that we're going to respond to emergencies, but we're going to prevent them. So showing them all the times that we could reduce the length of stay in the ICU by catching a patient's sepsis earlier on, for example. We looked at metrics like how long the ICU nurse was off their unit, so how many hours per shift. We looked at how many rapid response total. We looked at how long it takes, like the ER nurse, to transport patients to the ICU, so we could help with transport. We kept data to show how we had reduced the amount of code blues within the facility. So just an interesting statistic, after we started, the amount of code blues that happened outside of critical care went from about 50% of them to about 25%. So we cut that number in half. So data is the key to proving to admin. So if you've heard all of my spiels about rapid response nursing and you're like, I want to be a rapid response nurse, 1, do it. 2nd, I would say, go ahead and get your certification. There's so many certifications that you can get. I feel like there's value in having those letters behind your name, not for the letters themselves, for like bragging rights, but more because it shows that you took the time and the hours invested into studying to make sure you really know the content you have to know to save a patient's life or to be the expert in your field, in your niche. Nurse.org actually has a great article that just lists all of the certifications that are possible. So I'll link it right here for you if you wanted to check it out. Get some inspiration for maybe what certification you want to start studying for next. So I think the most common emergencies are not what you think. It's not like heart attack and stroke. Most often it's high heart rate, low blood pressure, can't breathe. We see those all the time. Patient goes into AFib RVR and they're tachycardic, or they become hypovolemic and their blood pressure tanks, or something happens with their lungs, pulmonary embolism, or COPD exacerbation, or fluid overload, or something, and now they're short of breath. Those are probably the most common ones that we see. But I also respond to all of the stroke alerts and all of the STEMI alerts and all of the sepsis alerts and all of the MTPs or massive transfusion protocol, all the code blues. What am I missing? Yeah, basically all of like the time is of the essence emergencies. I go to all of those. But I think the bulk of what we see is going to be arrhythmias, hypotension, and shortness of breath, which I love treating all of them. Why, yes, I do. I would say don't be afraid to call a rapid. If it turns out not to be an emergency, you cancel it. No big deal. While you're waiting for the team to show up, make sure your airway is open and patent. How is the patient's breathing? Do they need more oxygen? Give it to them. If they're not taking enough breaths, then give them more breaths with the BVM. Make sure you have access to the circulatory system, so check your IVs and make sure they're working. Go ahead and pull out whatever brain you have in your pocket or something like that to make sure you are able to give like a 60-second summary of what happened to your patient. As a rapid response nurse, I want to know, what are they here for? What's happened in the last hour? What concerns do you have? You don't have to go into all the details about their whole medical history. And then get a blood sugar. That's always important. A fresh set of vital signs, and just be ready to be of support to the team whenever they arrive. So for those of you that don't know, in addition to being a rapid response nurse, I also have a podcast called Rapid Response RN, where every episode I share a real life story of a patient that I've cared for. And then I break down the pathophysiology and the pharmacology and the nurse's important role in responding to and managing that particular emergency. So if you'd love to learn more about how to handle yourself in emergencies, what to do when your patient's crashing, you'll love my podcast. I'll link it below for you. We wear a backpack, and I personally wear a fanny pack. I'll do a part 2 with the backpack, but let me just start and show you what's in the fanny. Okay, my phone, not my personal one, my work phone. This is a pen light. Then I have stethoscope, but the stethoscope holder is called a bat clip. Then I have scissors. These are X shears. Then I have a little pack in the back, has an IV start kit, needles, extra gloves, red caps, got a stopcock in here, and then over here I have my multi-tool, which has, I don't know, flathead, Phillips head, pliers. And then here I have 2 types of tape and an N95 mask. I have flushes. I have a TPA dosing guide. I have syringes, chapstick, blunt access cannulas, alcohol wipes, and sustenance. And that's it. All of our monitoring cables. We have pulse ox probes, tele leads, tourniquet. We have a forehead pulse ox probe and a pressure bag. And then up here we have an IO drill and the IO needles. Oop. And then here we have our monitor, which is the CareScape 1. And then in here we have our portable ultrasound. We use the Clarius. So there's both the rounded probe and the linear probe, ultrasound gel, long IV catheters, and then here's our iPad for our screen. These are 511 bags. They are my favorite. I'm not sponsored by 511. I wish that I was, but these bags are so solid and they've gotten me through a lot of emergencies. The end. Thanks everyone for hanging out with me today for my Nurse.org takeover. It's been a blast talking about rapid response nursing, this field that I love so very much. If you'd like to learn more about rapid response nursing or just about how to handle emergencies in general, you can find me at the Rapid Response RN, or my podcast is Rapid Response RN.